5 health checkups to avoid after the age of 70 that may do more harm than good. There is a hidden truth that most older adults will never hear from their doctors. Every year, millions of seniors line up for routine checkups, convinced they are protecting their health. But what if I told you that some of those very tests, the ones your doctor insists you need, could actually push you closer to surgery, a stroke, or even cancer? New research shows that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And here is the shocking part: 99% of people past 70 have no idea they are being over-tested. One of these so-called checkups, the number one on this list, is responsible for around 5% of all cancer cases in the United States. That is the same number of cases linked to drinking alcohol every single day. You will not hear this at your clinic. You will not see it on a billboard. The truth is buried in the science, and today, we are uncovering it all. In this video, the 5 medical checkups you should avoid after 70, and the disturbing truth about what they may do to your body. All backed by solid science, and you will not believe what made it to number 2. Before we begin, let us know in the comments below where you are watching from, your age, and whether you have ever regretted a test or procedure. Do you think seniors are tested too often? We read and reply to every single comment with personalized tips and advice. Now, let us dive into the first test. It looks harmless at first glance, but it could quietly ruin your quality of life. Number 5, the bone density scan. On the surface, it sounds simple. A quick scan, no needles, no pain. You walk out thinking you now know if your bones are at risk for fractures. But here is what no one tells you. After the age of 70, a bone density scan often creates more fear than benefit. This scan, officially called a DEXA scan, measures the strength of your bones. Its main purpose is to detect osteoporosis. But in older adults, especially women, the results almost always show reduced density, even when there is no real danger. That is because bone loss is a normal part of aging. Just like wrinkles or gray hair, it happens to everyone. And yet, many older adults are pressured into taking drugs such as bisphosphonates, meant to strengthen bones, but carrying serious side effects, like jaw necrosis, where the jawbone begins to die, or severe irritation of the esophagus. Here is the real problem. Research shows that treating mild bone loss in people over 70 with medication has little to no impact on actual fracture rates. One study published in the Journal of the American Geriatric Society followed more than 1,200 women past 70. Bisphosphonates lowered fracture risk by only 0.3% over 5 years. That is something, but it is far from life-changing. Meanwhile, those women were much more likely to suffer painful side effects, digestive problems, inflammation of the esophagus, and bones so brittle they broke in unusual ways. Take Rose, a 76-year-old retired piano teacher. She was referred for a DEXA scan after her annual checkup. She had never fallen, felt no pain, and walked daily. Her scan came back with osteopenia, a mild reduction in density not considered osteoporosis. Her doctor quickly prescribed alendronate, a bisphosphonate. Within 3 months, she developed severe acid reflux and jaw pain. By the time we saw her, she had stopped playing piano altogether. We took her off the drug and instead gave her vitamin D, weight-bearing exercise with resistance bands, and a calcium-rich diet including sardines and leafy greens. 1 year later, she was back performing recitals, walking with better balance and fracture-free. A simple scan may look like a smart step, but for people over 70 who are not falling or breaking bones, lifestyle is often the far better option. Strength training, balance exercises, a nutritious diet, and treating vitamin D deficiency can reduce fracture risk by more than 20%. According to a 2022 study in Osteoporosis International, do not let a number on a screen push you into treatments you may not need. And yet, as risky as that sounds, there is one scan that can lead to something even scarier: brain surgery. Let us talk about that next. Number 4. The brain MRI for memory loss. When older adults begin to feel more forgetful or confused, the natural reaction is fear. Fear of dementia. fear of Alzheimer's, and so doctors often respond by ordering a brain MRI. But here is the uncomfortable truth. MRIs, which are detailed images showing the brain's structure, rarely provide the answers patients are hoping for. In fact, most MRIs in people over 70 simply reveal age-related changes, slight shrinkage, or tiny white matter spots that are perfectly normal in seniors. Here is the real problem. Once those spots are spotted, they often trigger a chain reaction of fear, more tests, and sometimes even surgery. Surgery that may not improve memory at all, and in some cases can actually make things worse. In 2021, a study published in Neurology Today reviewed more than 3,000 MRI scans in patients aged 70 to 85 who had mild memory complaints. 86% showed some kind of abnormality, yet only 3% were tied to an actual treatable condition. That means 97% of people went through the stress of being told something is wrong, when in reality, nothing dangerous was happening. Even worse, nearly 12% were sent for invasive procedures such as spinal taps or exploratory biopsies, all because of vague scan results. Take George, a 74-year-old retired engineer. He came in worried about forgetfulness. He was still sharp, but he misplaced his keys often and sometimes forgot names. His doctor ordered an MRI, which showed white matter changes. George panicked, convinced he had dementia. He stopped driving. He stopped attending church. Over the following months, his anxiety only grew worse. When we reassessed him with a standard cognitive test, his score came back perfectly normal. We explained that the MRI changes were simply age-appropriate. With that reassurance, we shifted his focus to lifestyle improvements, better sleep, hydration, and brain games. Within 3 months, his memory stabilized and he felt like himself again. The truth is this: unless someone is experiencing severe neurological symptoms, such as seizures, sudden changes in personality, or rapid decline in daily function, a brain MRI is rarely helpful in cases of mild memory loss. A far better first step is a simple cognitive screening test, a paper-based exam that evaluates memory, attention, and problem-solving. It is inexpensive, effective, and avoids unnecessary fear. Now, brace yourself because the next test on this list is one many people have already had more than once. And it is number 3 for a reason. Number 3, the cardiac stress test. This is one of the most common procedures given to seniors who complain of mild fatigue, chest tightness, or simply feeling less energetic than before. The stress test, where doctors monitor your heart while you walk on a treadmill, or after being given a drug that mimics exercise, is meant to find blocked arteries. But after the age of 70, this test often causes more harm than benefit, especially in people who do not have clear signs of heart disease. Why? Because it leads to false alarms and unnecessary heart procedures that carry very real risks. The issue is accuracy. Studies reveal that in adults over 70, the false positive rate for stress tests, meaning the test says there is a problem when there really is not, can be as high as 40%. This leads to follow-up procedures like angiograms, and in many cases unnecessary stents, or even bypass surgery. In 2017, a major study in JAMA Cardiology found that more than half of all stents placed after stress test referrals were done in patients who had no true symptoms and saw no real benefit. These patients did not live longer. They did not feel better. What they did experience were higher risks, more bleeding, kidney injury from contrast dye, and long hospital stays. This happened to Raymond, a 75-year-old retired postman who stayed active by walking every day. At one checkup, he mentioned he sometimes felt tired going up hills. Raymond's doctor scheduled a stress test just to be safe. The results came back unclear, so he was sent for a catheterization, a procedure where a thin tube is inserted into the arteries to look for blockages. A slight narrowing was found, and a stent was placed. But that very night, Raymond reacted badly to the contrast dye and developed kidney problems. He spent 6 days in the hospital and needed weeks of follow-up care. And yet, his fatigue never improved, because the problem was never his heart. He simply needed better hydration and more rest between meals. If you are over 70 and not experiencing classic heart symptoms, such as chest pain during activity, shortness of breath on exertion, or a significant drop in stamina during light exercise, a stress test may bring more harm than good. A safer choice is often a resting EKG, which checks the heart's rhythm while you are still. Another option is a coronary calcium scan, a low-radiation imaging test that shows whether dangerous plaque is building up. Both are simpler, safer, and far less likely to lead you into procedures you did not need. Now, let us move to number 2, the colonoscopy. You may not have expected this one, but a colonoscopy, the procedure where a long camera is used to examine your colon, is not always a smart choice after 70, and it is rarely recommended after 75, unless there are clear symptoms. Why? Because the risks grow with age. The preparation alone is harsh, requiring strong laxatives that can cause dehydration, dizziness, or kidney strain. The sedation used during the test carries additional risks to brain function in seniors. And surprisingly, the procedure itself can sometimes lead to bleeding, tearing, or even irregular heart rhythms while sedated. A 2019 study in JAMA Internal Medicine followed more than 1.3 million Medicare patients aged 70 and older. For every 1,000 colonoscopies performed in adults over 75, only 2 lives were saved, but more than 20 people suffered serious complications. That is a 10-to-1 risk-to-benefit ratio. Even when polyps are discovered, many are small and slow growing. Removing them in an older adult can sometimes cause more harm than leaving them alone. Take Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in her stool, and no family history of colon cancer. Yet her new primary doctor, fresh out of residency, urged her to undergo a screening colonoscopy. She agreed. During the test, a small polyp was removed, and she went home. That very night, she developed severe abdominal pain and collapsed. At the hospital, doctors found a bowel perforation. She spent 9 days recovering, lost 10 pounds, and never fully regained her health. When we reviewed her case, we discovered she had already undergone 2 clean colonoscopies in the past. There had been no reason to repeat the test. The United States Preventive Services Task Force currently advises stopping routine colon cancer screening at 75 for most people. For those in excellent health, a stool-based test, like the FIT test, a non-invasive at-home fecal test, is usually a safer option. There is no prep, no sedation, and it still detects most concerning cases. Always ask your doctor about alternatives, because once you enter the colonoscopy cycle, it can be hard to step out. And now we arrive at number 1, the most overused, most dangerous, and most harmful checkup for seniors. Chances are, you may have had this one done yourself, the annual full-body CT scan. These scans, often sold as part of executive health packages or preventive checkups at private clinics, are marketed as a way to catch cancer early. But here is the shocking truth. Full-body CT scans expose your body to massive doses of ionizing radiation. For older adults, especially those over 70, the risk of triggering unnecessary follow-ups, biopsies, or even surgeries is extremely high. And the irony is this: there is zero evidence that full-body scans in people without symptoms actually save lives. Each scan delivers between 10 to 20 millisieverts of radiation, about the same as 500 chest X-rays. A 2020 modeling study published in JAMA Internal Medicine suggested that the surge in CT scans across the United States may now be responsible for up to 5% of all cancers, placing them on the same level as alcohol as a cancer-causing factor. That means 1 out of every 20 cancers could be triggered by a scan that was originally meant to prevent disease. That is not just counterproductive, it is terrifying. A full-body CT scan can pick up harmless nodules, calcifications, or cysts that are simply a natural part of aging. But once those are spotted, alarm bells go off, more scans follow, then biopsies, and soon panic sets in. Let me share the story of Marcus, an active 80-year-old who used to teach martial arts to younger seniors. He felt perfectly fine and decided to take part in a senior elite checkup at a private clinic. His full-body scan revealed a tiny 3-millimeter nodule. That one small finding set off a chain reaction. He was referred to oncology, sent for a PET scan, and eventually underwent a needle biopsy. The result was benign, but the biopsy collapsed part of his lung, forcing him into the hospital and leaving him with a 2-month recovery. All of that for something that could have been safely ignored. Experts now caution that full-body CT scans should never be used for general screening in adults who have no symptoms. The American College of Radiology is clear. There is no proven benefit and significant potential for harm. If symptoms such as unexplained weight loss, coughing up blood, or visible swelling appear, then a targeted scan makes sense. But scanning the entire body with no specific reason is like searching for treasure with a landmine detector. You may uncover something, but the damage caused could be far worse than the problem you were looking for. A safer and wiser approach is to listen closely to your body. If you feel well, keep up with regular checkups with your primary doctor and only undergo tests that are clearly needed. Your time, your energy, and your health are too precious to waste on fear-driven screenings that might leave you worse than where you began. So, there you have it. 5 checkups that may seem helpful but can actually cause harm. Modern medicine is powerful, but it is not perfect. Sometimes, less truly is more. Always ask yourself, what happens next? If this test finds something, what will that mean for me? If the answer is unclear, or if the risks outweigh the rewards, maybe it is time to pause. And remember, true prevention starts with lifestyle. Stay active. Eat nourishing foods, sleep deeply, and choose your checkups wisely. Now we want to hear from you. Have you or someone you love ever suffered complications from a medical test or treatment that turned out to be unnecessary? What happened? Share your stories and opinions in the comments below. Thank you for watching.